This video comes with a trigger warning. I'm going to be discussing postnatal care after stillbirth. In the UK, it's Baby Loss Awareness Week in October and allows a time for us to support families who've gone through baby loss and pregnancy loss, as well as campaigning for better bereavement care. I think this video is really important to make because people who've experienced baby loss, stillbirth, miscarriage will still deserve physical and emotional care. I'm Remy, I'm an obstetrics and gynecology doctor with over 10 years of experience. I'm not a bereavement specialist. However, throughout my years in practice, these are people that I've looked after a lot. And what I want to share and say in this video is that postnatal care and care after loss is really, really important. This video is for educational purposes. It's not personalised medical advice. And if it raises anything in you, I really hope that you would seek advice from your midwife or your GP. I'm very aware of how sensitive this topic can be and hope that you can receive it with the intention that it was meant. In the UK, stillbirth is described as any pregnancy that's lost after 24 weeks. Before 24 weeks, it's typically termed as a miscarriage. The latest numbers show that 1 in about 311 births will result in a stillbirth. There are many causes of this. Typically, it's due to placenta. There are other things that can cause loss in this time period, which I won't really be going into in this video. The timing of the loss will often determine the type of delivery that happens, but the delivery can be a vaginal delivery or surgical intervention such as a cesarean section or other types of surgical deliveries. After the delivery, the mainstay care is delivered by the bereavement team, which is typically made up of specialist midwives, and they will take the family through certifying the loss of the baby, arranging for any further investigations based on the family's wishes, as well as any burial or cremation plans. There would also be a really good point of contact to share resources and support groups in helping the family come to terms and deal with the loss going forward. The point of this video is that after the delivery, the body will go through changes, emotional, hormonal, that are to do with the delivery and the pregnancy alone. And these things need to be looked after, heard, and supported. At the end of pregnancy, there is a major hormone shift. The hormones that have upheld the pregnancy are now rapidly going back to normal. The volume of the blood that was circulating around the body, again, is now going back to normal. And in all this, physical recovery needs to occur. In the first 24 hours, the first few days, it's making sure that there is no excessive bleeding coming from the vagina, making sure that the womb is now contracted and going back to its original position within the abdomen. And that shifts in the hormones that will affect sleep, that will affect mood, that can lead to the production of milk. And with milk production, medication can be given to stop that supply. In addition, going through the emotional trauma of having lost the baby can often compound physical pain, and therefore both need to be addressed and cared for sensitively during this period. Thinking about an example, if a woman had high blood pressure in pregnancy that caused her to have issues with the placenta, and unfortunately that led to a stillbirth, after delivery, as a clinician, I'm still really interested in the blood pressure management for that patient. So making sure that the blood pressure is well controlled with the medication that we're giving, or if they need a change in medication, to make sure that the blood pressure is well controlled. Because if the blood pressure is not well controlled, then they're at risk of things like seizures, strokes, and long-term heart disease. So these are the examples of where the care after the delivery can be way more complex as well and need extra support and care in hospital. And even amongst that, making sure that the emotional support is there for the person. There is national guidance about how to care for women and their partners when going through this, and it's about making sure that there is space for them to talk, that they are looked after by the right team, the bereavement midwives. And unfortunately, there will be a variety in how good some services are in certain trusts, but the idea is that you have support from the midwife and the GP if and where needed. Aside from the medical recovery that's required to provide the necessary emotional support, the person with their family are often offered to see the baby, and this could be accepted or declined. There is no right or wrong answer. They can have pictures taken with the baby, they can have footprints, they can have memorabilia like blankets, cards, footprints, handprints. And all of these things can be done and arranged within the department to help in the emotional support. But there is no right or wrong answer. They're all offered, but they don't have to be taken. Following this, there will be an offer of follow-up in secondary care. This will be an appointment offered a few weeks to months later, where you can revisit investigations that have been done for both yourself and also on the baby, and that might inform your future pregnancies and determine what extra support is needed in a subsequent pregnancy. Outside of this, you should have the emotional support from the bereavement team and the GP, where you can have space to talk about what's happened, the delivery, the pregnancy, to be referred on to support services, but also to be referred on for psychological support if needed in the form of therapy or group therapy or trauma-focused therapy. And all of these things can again be accessed through the midwife or the GP. So if you've gone through baby loss, I want you to know that you deserve care, physically and emotionally, and there is support out there. Obviously, with the Point of Awareness Week, trying to improve the amount of support that's available to families that are going through this. But if you feel that you have gone through this and were unfortunately not able to make the most out of care, consider getting back in touch with the bereavement team and seeing what else they can do to support you. In addition, you can ask for a birth debrief or a pregnancy debrief. And again, that can be done by your obstetricians, by specialist midwives, and they can again take you through that whole process. For the purposes of this video, I will also list down below resources that might be good for you to have a read through, knowing that there are other people who have gone through what you're going through and the support that's available to them. Thank you for watching if you've made it this far. I would love to hear some feedback from you if it's something that you've been through. What have you found that has been helpful? Because if you were to leave it in the comments, it might prove beneficial to the next woman watching. Until my next video.